So osteoarthritis is one of the most common degenerative conditions people over age 50 have. But a lot of people, they think they do not have any significant joint pain, so they don't think they have osteoarthritis. But I think if anybody who wakes up in the morning feeling some achiness in the joint or in the body, you actually have some chronic inflammation related to aging and may not have shown as osteoarthritis, but anybody aging, your cartilage is being worn out over years. If you do not have significant chronic inflammation in the joints and do not have clinical pain that prevents you from doing a lot of daily activity, that still doesn't mean you do not have osteoarthritis. But for people who already are diagnosed with osteoarthritis by their orthopedic doctors saying they are bone on bone or they are at grade 2 or 3 of osteoarthritis, then most people's choice of treating the osteoarthritis is limited to steroid injection, physical therapy, and eventually if the pain is too much, then they go through joint replacement for the knee or hip. But for some other joints like elbow or wrist, thumb, or even shoulder, it's very difficult to do the joint replacement. So basically the conventional treatment would be pain medication, physical therapy, steroid injection, and then in the end is you just deal with it. With stem cell therapy, we can actually help your joint to reconfigure the internal joint structure. It can also stimulate your own body stem cell to regenerate a little bit of cartilage so that you're not having a lot of friction from the lack of cartilage. Then the inflammation in the joint is reduced without taking pain medication or steroid injection. And one thing about steroid injection is steroid injection itself in the long term, because for most people having osteoarthritis of joints, they need steroid injection at least twice a year. And if they keep doing this for 10 to 15 years, the steroid itself is weakening your tendon and ligaments. So it actually makes your joints even weaker, and long term, they can actually even more prone to inflammation and injuries. Some people in their age 80s, they've been having steroid injection for the shoulder for the past 15 years, and then eventually it actually can stop working for the pain. Because initially they work. Once you get steroid injection, you get some relief for a few months, but then you have to do it again. But then at some point, actually the steroid injection will stop working as well. If you have any minor or major osteoarthritis symptoms, if you do stem cell treatment into the joint, it can reduce the pain within a week of the injection and also gives you longer lasting effects. And also the stem cell injected into the joint does not weaken your tendon and tissue ligament over time. It actually strengthens your joint structure over the long term versus the cortisone injection.